Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to today's podcast segment. Thank you for joining us as we explore an important topic that affects many individuals and communities. Before we begin, it's essential to note that our discussion is for educational and reference purposes only. It is not medical, psychological, or professional advice. Many people have experienced moments when they feel uneasy about their substance use. Perhaps they notice that their drinking habits are causing discomfort or leading to negative consequences in their lives. It's important to understand that concerns about substance use can exist without the necessity for permanent cessation. Consider this: a person might recognize patterns they wish to alter without aiming for complete abstinence. This does not imply that ceasing use is not indicated in certain situations, nor does it mean that these concerns are unimportant. A common misunderstanding is that any concern about substance use automatically requires a rock-bottom event or a lifetime commitment to abstinence. This perspective conflates initial concerns with a predetermined outcome, overlooking the stages of evolving understanding. Another misconception is that if someone expresses concern, they are necessarily seeking a cure for a diagnosed disorder. In reality, expressing concern can reflect a desire for moderation, boundary setting, or risk reduction rather than a clinical label. In practice, a person may identify specific behaviors or consumption levels that cause them discomfort or have negative impacts. This could include financial strain related to substance use, conflicts in relationships, or diminished performance in daily tasks. Recognizing these impacts constitutes a concern. It points to an area that the individual might consider changing. The aim of such changes is not universally about permanent cessation. It could involve setting specific quantity limits, reducing frequency, or avoiding particular contexts where substance use occurs. It's crucial to clarify what this does not mean. It does not imply that professional evaluation for substance use disorder is unnecessary. Concerns can sometimes align with criteria for clinically diagnosable conditions. Furthermore, this does not endorse any particular approach to managing substance use. There are various strategies, and their applicability can vary based on individual circumstances. Lastly, concerns are significant even if permanent cessation is not the immediate goal. Early concerns can be indicators of developing patterns or risks that deserve attention. Understanding these nuances matters greatly for recovery communities, behavioral health awareness, and broader public health conversations. For those exploring careers in substance use disorder counseling or behavioral health, grasping these topics can help prepare them for the complexities they may encounter in their work. Topics like this are often explored in addiction counseling education. Programs such as those offered at InterCoast colleges include discussions about behavioral health and recovery support. If you'd like to learn more about education pathways in this field, you can visit intercoast.edu. Thank you for listening, and we hope this conversation has provided you with valuable insights.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.